Hey, Allied Health. We're going to talk about lesson seven, environmental emergencies, and we're going to start out with cold-related emergencies, um, and then poisons and heat-related emergencies because they're more relevant. Um, so, cold-related emergencies can happen at any time of the year because it's anytime our body temperature lowers. So, and cold-related emergencies involve two things: hypothermia and frostbite. Hypothermia is when your body temperature lowers. Frostbite is when a limb, usually your fingers, your toes, your ears, or your nose, becomes frozen. And we're going to go through some true and false activities here in a little bit. We'll back up. So, hypothermia, signs and symptoms of hypothermia. All right. So, again, that's when your body temperature lowers. Hypo is lower. The person may seem indifferent, disoriented, or confused if they are hypothermic. They may have a glassy stare, become unresponsive. Initially, the person may shiver, but as the core body temperature continues to decrease, the shivering may stop. This is a sign that the person's condition is worsening and he or she needs immediate medical care. So, if you come across a person who you believe may have hypothermia, what should you do? Get the person someplace where he could take a hot bath or shower, give the person a hot shot of brandy or a cup of coffee, or move the person to a warmer environment. Make sure the person is wearing dry clothing and wrap them in a blanket. Guess what the answer is? C. You do not want to put them in a hot bath or shower. That's not going to be too good for them. A shot of brandy will lower their system. It's a depressant, and a cup of coffee will accelerate it. The big thing is in cold and winter related emergencies, we want to move the person to a warmer environment, a safe place, and get them into dry clothing and wrap them in a blanket. We want to put them near a heat source, but not on it either. Okay? You want to call 911 and help the person warm up gradually by helping him or her put on dry clothing and wrapping the person in a blanket. Move the person to a warmer place, remove wet clothing, and then warm the person up gradually. Um, we'll talk about frostbite. The big thing is you can put them near a heat source, but the body temperature comes from the inside out. So if you want to give them something warm to drink, that's fine. Just something without caffeine or alcohol. Frostbite is related to it. That's where body appendages freeze. And frostbite is an injury caused by freezing of the skin and underlying tissues as a result of prolonged exposure to freezing or sub-freezing temperatures. The nose, ears, fingers, and toes are most often affected. The frostbitten area is numb and the skin is cold to the touch and appears waxy. Skin may be white, yellow, blue, or red. In severe cases, there may be blisters and the skin may turn black. So, true or false? Frostbite can be treated by rubbing snow over the affected area. False. Treatment of frostbite starts with gradual rewarming. Remember, first we want to move them to a warm place and warm them up gradually. Rubbing snow or anything else on the affected area only causes additional pain and tissue damage. And in the long term, that tissue damage and that infection damage is the greatest risk. Gently massage the frostbitten area to restore circulation and warm it up. Handle the frostbitten area gently. Massage or rubbing the affected area can cause additional pain and tissue damage. Immerse the frostbitten area in hot water. Apply a heating pad or hold it close to a fire to rewarm tissues. No. Again, rewarming the frostbitten area with direct heat can cause additional damage, including burns. You can use warm water or hold the appendage in between your hands would be even better. Okay? If frostbite is severe, the person is also showing signs and symptoms of hypothermia. Call 911 or designate an emergency number. Do not break blisters. Monitor the person's condition. If the person develops signs or symptoms of shocks, give care accordingly. If rewarming is attempted, skin-to-skin contact may be sufficient to rewarm the frostbitten area if the frostbite is mild. Alternatively, rewarm the frostbitten area by soaking it in warm water, not hot, until normal color and warmth returns. After rewarming, loosely bandage the area with a dry, sterile bandage. Place cotton or gauze between the frostbitten fingers or toes before bandaging. Okay, we don't want them to stick together. So we don't want to use tissue or something that's going to make it stick together either. All right, so that's a little video on cold related emergencies. You should do your reading and answer your questions next.